Thanks for listening this morning to IRG Physical and Hand Therapy's Health Talk. I'm Ron Schakal with Shannon O'Kelly, and it's time for Part 3 with Dr. Tyson Hawkins.
Yeah, Dr. Hawkins, internal medicine physician, Part 3. We're talking about health screening for men in your 60s, Ron.
Should be good stuff. Here's Shannon O'Kelly with Dr. Hawkins.
Well, here we are, our third time on the air together. Dr. Hawkins, how are you?
I'm doing great. How are you, Shannon?
I'm doing great. Listen, we've been talking about men's health and kind of general screenings. Here we are. Going to talk about like in your 60s and 70s. You know, I got to say, it's almost imperative that we listen to you and what you have to say because, again, men have a tendency to kind of delay their care. And I don't think you can get through life without your check engine light going on sometime in your life. Particularly, it seems like around the 60s or 70s, that blinking red light comes on in our bodies. So let's talk about kind of the need in your 60s, maybe what we should be looking at.
Yeah, absolutely. So this is, I'd love to say that every year or every age range is critical, but 60s and 70s, I would put at the top of the list. If you haven't been in for a screening exam, now is the time. The average age of diagnosis of prostate cancer, colon cancer, and your first heart attack or heart disease is all in the 60s. So this is a time where you're coming in, and if you haven't had screening before, you're getting your first screening, which is critically important. And for most people who've come in earlier, maybe in their 40s and 50s, this is the time to make sure that you're up to date on your screening. Maybe you've had a colonoscopy and you had a polyp or something, and you needed to have a follow-up colonoscopy. And it's hard to keep track of those things. And so your primary doctor is on top of that stuff. And so coming in and saying, I think I might be due, I don't know, am I due? And then getting back in for your screening. Yeah,
colonoscopies. Right now, what are they saying? What are they recommending? I know that it's changed a little bit. It used to be in your 50s, but are now they saying 45 and then every 3 years or based on your findings? What is the kind of data on that?
Right. Yeah, absolutely. It is. Things do change, and that's really important to realize because, again, if what we've said 10 years ago, maybe the data has changed and the advice has changed. And so staying in touch with your doc and going in every few years is important because the guidelines may change and you might be due and you may not have been due before based on previous guidelines. But yeah, the guidelines on when to start are dropping down to age 45, used to be 50. And the recommended interval is all about your risk, which comes down to your family history or the findings on the colonoscopy. So polyps are the thing we're really looking for. And if there's a few polyps, we might recommend coming back in 3 to 5 years. If there's no polyps, then as long as you don't have a family history, then it's every 10 years.
Yeah, what's really interesting about it, it's just not, colon cancer is important. Shoot, I read something the other day that you can get lymphoma, a blood cancer in your bowels. I don't know why I didn't really think about that. I always just thought lymphoma was in your lymph nodes, but I have a person that I know that had a colonoscopy and was discovered that had some type of lymphoma. I just, like I said, that surprised me, shocked me.
Yeah, absolutely. We never know what we're going to find, but that obviously that's not necessarily the goal of that screening test, but there are some side benefits there.
Let's talk about cardiac disease, and particularly as you get into that 60s, and we talk about cardiac arrest, and then we talk about heart attacks, and we talk about angina and chest pain and signs and symptoms. It's not uncommon, that's for sure. I don't know. I read something the other day that cardiac disease, heart attacks is kind of like the number 2 killer or disease in men at 60 and 70.
Yeah, I think heart disease has got a stronghold on that number 1 spot. It has for years, and I don't think that's probably going to change. The heart is one of our vascular beds, so it's one place where the blood, where we get plaque in the arteries. But it's important to realize or remember that our body has blood vessels in a lot of different places. So we've got peripheral vascular disease, which is blood flow into our legs and arms. And we've got cerebrovascular disease, which is blood flow going to our brain. And so the same disease process that causes heart attacks causes strokes. Coming in, you're getting your blood pressure checked, you're getting your weight checked, you're getting cholesterol, you're getting sugar. These are all risk factors. You're talking about smoking and stopping smoking if you do. These are all the things that put people at high risk of plaque in the arteries.
Back with more with Dr. Tyson Hawkins and Shannon O'Kelly right after this timeout on KOMO.
It's a Northwest Lifestyle Weekend on KOMO News. This is IRG's Health Talk. Back to Tom Hutler and Shannon O'Kelly.
Welcome back to IRG Physical and Hand Therapy's Health Talk. I'm Ron Schakal with Shannon O'Kelly. Continuing our discussion with Dr. Tyson Hawkins. It's actually part 3, and he is an internal medicine practitioner at PeaceHealth Medical Group in Whatcom County, talking about men's health for those over 60. Here's Dr. Hawkins and Shannon O'Kelly.
Okay, we're talking to Dr. Hawkins, Tyson Hawkins. He's an internal medicine physician at PeaceHealth up in Bellingham, and it's been a pleasure talking to Dr. Hawkins. We are on Series 3 of general screenings for the men's health population. I want to talk to you about something, Dr. Hawkins. Here is, our immune system. As we age, it weakens. We know that we see on the TV, get your shingles shot, get your pneumococcal pneumonia shot, all that stuff. Talk about that with us a little bit in your perspective as a physician on that.
Absolutely. So again, this is, I hate to say this is the critical age range, but again, this is an inflection point in medicine where over the age of 60, we really start, there's a bunch of guidelines about immunizations that really start to take off. And so we recommend shingles vaccination for anybody over the age of 60. We recommend pneumonia vaccines, anybody over the age of 65. Tetanus boosters are still things that we recommend every 10 years. We still like flu shots. I know in the pandemic, we haven't seen as much of the flu. All the masking and social distancing works, but the flu is gonna stick around. So coming in and getting your flu shot is also important.
What about shingles, for example? I mean, that's a very good topic because people need to understand is you have this virus that lies dormant in your body. And the problem is when your immune system becomes suppressed, that virus presents itself, and that's why you get those shingles. And so that vaccination enhances your immune system to make sure that virus stays dormant. Is that fair to say?
Yeah, absolutely. I have an analogy. It's probably too long for me to share on air here, but it has to do with a castle and where we keep that virus kind of in a holding cell. But yeah, vaccines are a reminder to your immune system. So in the case of shingles vaccination, you're absolutely right. Your body has seen chickenpox before. So it knows about chickenpox, but it's forgetting. It's as the immune, if we can call the immune system getting weaker as the number of different immune cells that remember chickenpox, you're getting less and less of them. So your memory is getting a little weaker. So getting a booster or a vaccine is telling your immune system, hey, don't forget about chickenpox so that it doesn't pop back up in the form of shingles. And you're absolutely right. Anybody who's had shingles will tell you, boy, I never want to have that again. And I wish I would have been vaccinated. And I'll tell you that when we see people in clinics who've had the vaccine and get shingles, and you still can, versus people who have not been vaccinated, it is grossly different. It is a mild case compared to something just horrific at times.
Dr. Hawkins, man alive, thank you so much. I mean, here we are wrapping up our 3rd-part series on men's health and screenings. And the bottom line here, you guys listening out here, don't be afraid to go in and have that annual physical. It's really important. Dr. Hawkins, we're going to have you back on. I'd love to continue our conversations just in various topics. You've been fantastic.
I'd love to. Thanks, Shannon.
Well, that was great information. Part 3 with Dr. Tyson Hawkins, men's health for those age 60 and over, Shannon.
Yeah, Ron, it reminds me that I have to get my annual physical coming up here in a couple of months. So always keeping that on your radar screen, particularly as we age, we should be getting in and getting these things looked at because, one of these times your check engine light's going to blink for sure, right? So you got to keep an eye on that.
I'm afraid mine is blinking very fast.